It happens in an ordinary moment. You are settled on the couch after a long day, your dog curled up beside you the way they always are, close enough that their warmth is part of the routine. They shift, yawn, breathe, and something stops you. Not a sound, a smell, and not the familiar, faintly warm smell you have learned to ignore over years of closeness. This is something else, something deeper, something that sits in the back of your throat and makes you turn your head. You lean closer because part of you wants to be wrong. You gently check the mouth, maybe lift the lip, and glance at the teeth. Nothing looks obviously wrong, no broken tooth you can see, no visible wound, just that smell rotten, or chemical, or heavy in a way that is difficult to name sitting there like a quiet question you are not sure how to answer. So you do what most caring owners do. You tell yourself it was probably something he ate. You move on, but the smell comes back the next evening, and the one after that, and now, somewhere underneath the ordinary rhythm of your day, a small worry has taken hold. Not panic, just that low, persistent feeling that something may have changed, and you are not sure whether it matters. Here is what that feeling is actually telling you. A sudden or noticeable shift in your dog's breath odor, especially when it becomes distinctly rotten, sweet, chemical, or sharp, is not the same thing as ordinary dog breath. It belongs to a different category entirely, and the specific character of that smell may already be pointing towards something worth understanding. That is exactly what this video is going to help you do. Let's be honest about something first. Every dog has some degree of mouth odor. That mild, warm smell after a nap, or the faint food smell that lingers after dinner that is normal, and no amount of dental chews is going to eliminate it entirely. If you have lived with a dog for any length of time, you already know what your dog's breath smells like. You have a baseline, even if you have never consciously thought of it that way. That baseline is exactly why you noticed something was different. What we are talking about in this video is not background odor. We are talking about a qualitative change, a shift in the character of the smell itself. When dog breath crosses into territory that is distinctly rotten, or carries a sweet chemical quality, or smells faintly of ammonia, or reminds you of something decaying, that is a different conversation. That kind of change is worth paying attention to, not because it automatically means something is seriously wrong, but because your dog has no other way to tell you that something has shifted internally. That matters more than most owners realize. Dogs are remarkably good at hiding discomfort. Early changes in organ function, early dental disease, early metabolic shifts, none of these announce themselves with obvious dramatic symptoms in the beginning. An odor change is sometimes one of the only early signals available to an attentive owner, and you noticed it. That already puts you ahead of where most people are when they eventually seek answers. One more thing before we go further. A lot of owners delay looking into this because they are quietly worried about what the answer might cost them. That is an honest concern, and this video will clearly separate what you can observe and manage at home from what genuinely needs a professional evaluation. Not every cause on this list requires an urgent veterinary visit, but some do, and knowing the difference is the entire point. The 5 causes ahead range from manageable dental buildup to signals of systemic conditions that respond significantly better to early attention. Understanding which one fits your dog's situation is what changes your next step from uncertain to clear. What you are about to hear is grounded in established veterinary sources, dental health research, internal medicine references, and clinical diagnostic guidance used by practicing veterinarians. This is not a list of internet remedies or anecdotal advice collected from forums. The 5 causes covered in this video are recognized in veterinary literature as meaningful, documented explanations for halitosis in dogs, and each one comes with observable patterns that can help you understand what you are actually dealing with. A few honest boundaries before we begin. No video can diagnose your dog. Breath odor alone is a starting point, not a conclusion, and the same smell can occasionally point in more than one direction. What this video gives you is a framework for recognition, not a replacement for professional assessment when that assessment is genuinely needed. Throughout each cause, you will hear clearly when home observation is reasonable and when a veterinarian needs to be part of the picture. Think of the information ahead as a translation tool. Your dog cannot tell you what has changed or where something feels different, but a shift in breath odor, when understood in context, can carry real and useful meaning. The goal is to help you read that signal accurately, calmly, clearly, and without either dismissing something important or overreacting to something manageable. That is the standard this video is built around, and it is the only standard worth your time. Most owners picture dental disease as something visible, a cracked tooth, an obviously swollen jaw, a dog that flinches when they eat. So when the teeth look reasonably white and the dog is finishing every meal without hesitation, it feels safe to cross dental problems off the list. That assumption is one of the most common and most consequential mistakes owners make when trying to understand where a rotten smell is coming from. The reality is that the majority of significant dental disease in dogs lives entirely out of sight, not on the surface of the tooth, but beneath the gum line, in the narrow pockets of tissue that surround each tooth root. This is where bacteria accumulate, where plaque hardens into tartar, and where an environment forms that is genuinely hostile to healthy tissue. Studies and veterinary dental health data consistently estimate that around 80 to 85% of dogs over the age of 3 show measurable signs of periodontal disease, and most of their owners have no idea because the mouth looks largely normal from the outside. The smell this process produces is specific, anaerobic bacteria, the kind that thrive in the oxygen-poor pockets beneath the gum, break down protein material and release compounds called volatile sulfur compounds in the process. Hydrogen sulfide and methyl mercaptan are the main culprits. If those names sound unfamiliar, the smell they produce is not. It is the same chemistry behind the odor of rotten eggs, decaying organic matter, and the sharp, deeply unpleasant smell that makes you instinctively pull back. When your dog's breath carries that particular quality, sulfuric, heavy, and persistently foul, regardless of what they have recently eaten, periodontal disease moves to the top of the list of likely explanations. What makes this harder to catch is that dogs rarely show pain the way we expect. A dog with significant gum disease may continue eating normally, playing normally, and behaving entirely as usual. The signs, when they appear, tend to be subtle. Look at the gum line rather than the teeth themselves. Healthy gum tissue is pink and firm, sitting snugly against the base of each tooth. Redness, puffiness, or a brownish discoloration where the gum meets the tooth are worth noting. Some dogs will resist having their mouth touched, turn their head away during grooming, or occasionally paw at the side of their face. These are quiet signals, easy to miss unless you are specifically looking for them. If your dog tolerates it, a gentle gum line check under good lighting is a reasonable first step. Introducing a dog-safe enzymatic toothpaste, and it must be formulated for dogs, because human toothpaste contains ingredients including xylitol that are dangerous to them, can help slow bacterial accumulation at home. The Veterinary Oral Health Council recognizes enzymatic toothpaste and certain dental chews as having demonstrated efficacy for reducing plaque and tartar. What toothbrushing cannot do is reverse disease that has already progressed beneath the gum line. If the gums look inflamed, if your dog shows any sign of mouth sensitivity, or if the odor has been present for more than a week or two without improvement, a professional dental examination is the appropriate next step, not another bag of dental treats. Periodontal disease is the most common cause of halitosis in dogs, but it is far from the only one. If the smell coming from your dog's mouth is less like something rotting and more like something sweet, almost chemical, closer to nail polish remover than to decay, that is a meaningfully different signal, and it points somewhere else entirely. Rotten breath usually makes you think infection, but some owners notice the opposite. They lean in and the smell is oddly sweet, like overripe fruit, or that sharp acetone note you get from nail polish remover, because it's not gross in the same way. It's easy to shrug off. That sweetness can sometimes be a metabolic warning. In dogs, uncontrolled diabetes mellitus can lead to the body using fat for fuel instead of sugar. When that happens, the liver produces ketones. One of those ketones, acetone, is volatile, so it leaves the body through the lungs. That's why the breath can smell fruity or chemical. Breath alone doesn't diagnose diabetes, so pair the smell with what else you're seeing. Common clues include your dog suddenly draining the water bowl, needing to go out to pee more often, or having accidents after being reliable for years. Some dogs lose weight even though they're eating normally or seem hungrier. You may also notice low energy and in many dogs, especially females, cloudiness developing in the eyes over time. Here's the safety line. If that sweet/acetone breath shows up with lethargy, vomiting, or a drop in appetite, don't watch and wait. Diabetic ketoacidosis can progress quickly and needs veterinary care the same day. Even if your dog seems mostly okay, a call to your veterinarian for guidance is the safest move because early diabetes is often manageable once identified. If your dog is diagnosed diabetic, any new breath change or vomiting is a reason to phone your clinic immediately. And if the smell you're noticing isn't sweet at all but sharp or more like ammonia or urine on the breath, that points us toward a very different organ system, the kidneys. Sometimes the smell isn't rotten eggy and it isn't sweet. It's sharp like ammonia, like a whiff of urine. Owners often assume he must have licked something weird, or that's just older dog smell. But an ammonia-like breath odor can sometimes be associated with kidney disease. Here's the plain English reason. Healthy kidneys filter waste products out of the blood, including urea. When kidney function declines, urea can build up in the bloodstream. In the mouth, bacteria can convert urea into ammonia. That ammonia shows up on the breath and in saliva, creating that distinct urine breath. Because kidney disease can develop gradually, the other signs may be easy to miss at first. Watch for changes like drinking more than usual, peeing larger amounts, or later, peeing less. You may notice slow weight loss, a dull coat, decreased interest in walks, or intermittent nausea or vomiting. None of these proves kidney disease, but together with an ammonia smell, they're a strong reason to get a veterinary check. The safest next step is a scheduled appointment for a blood panel and urinalysis. Those tests help your vet assess kidney function and, if needed, stage the problem so the plan matches your dog's situation. One important caution: don't start restricting protein or switching to a kidney diet on your own. Nutrition for kidney disease is evidence-based, but timing and formulation matter. And if your dog seems very unwell, vomiting repeatedly, refusing food, or acting unusually weak, don't wait for a routine slot. Call your clinic for same-day advice today. If the breath smells foul but more like fermentation or feces, especially with regurgitation or a history of eating things outside, that's often a different pathway, and it starts in the gut. Some breath smells like the mouth. This one smells like the trash can. If you've ever had your dog trot in from the yard, lick your face, and you think, oh no, what did you eat? You know this category. Fecal smelling or fermented breath often comes from gross but common causes: eating poop, raiding the litter box, getting into garbage, or swallowing something that doesn't agree with them. The easy assumption is, okay, it'll pass. And sometimes it will, especially if you know exactly what happened and your dog is bright, eating, and acting normal. But here's the detail many owners miss. When that odor keeps coming back and you can't link it to a one-time snack, the problem may not be in the mouth at all. It can start in the digestive tract, especially if food isn't moving normally. In conditions like megaesophagus, food can sit in the esophagus instead of reaching the stomach. It can ferment, bacteria can multiply, and the breath can smell foul, sometimes even fecal, because those gases come right back up. The clue to watch for is regurgitation, not vomiting. Vomiting usually involves retching and stomach effort. Regurgitation is more passive. Food or liquid just comes back up, often shortly after eating, and it may look undigested. A safe next step. If you're sure it was a dietary mishap, prevent access, offer meals as usual, and monitor for 24-48 hours. But if the smell is recurring, unexplained, or paired with regurgitation, call your veterinarian and schedule an evaluation. Before the final cause, let's pause and organize what we've learned so far. Quick reset, because your brain is probably sorting smells into categories right now. If the breath is sulfuric, like rotten eggs, think gumline and periodontal disease, even when the teeth look fine. If it's sweet or acetone-like, especially with thirst, peeing, vomiting, or low energy, diabetes and ketoacidosis move up the list. If it's sharp and ammonia-like, paired with changes in drinking, appetite, weight, or nausea, kidneys deserve a closer look. And if it's fecal or fermented, ask whether it's a one-time diet incident or a recurring pattern with regurgitation that points to the gut. Right now, focus on 3 clues: the smell type, what else changed, and when it started. Because number 5 is less common, but delay matters. It can hide in mouth, and odor may be first hint too. Here's the 5th cause, and it's the one most owners miss because they do the logical thing. They lift the lip, see teeth, see pink gums, and assume nothing's there. But some oral problems hide in the parts you don't naturally look at under the tongue, along the back molars, high on the palate, or deep where the gum meets the cheek. Oral tumors, both benign and malignant, can start small and out of view. When they ulcerate, or when parts of the tissue lose blood supply and begin to break down, necrosis, bacteria move in, and the odor can turn intensely rotten, more like decay than dog breath. And unlike routine dental funk, it often doesn't improve with dental chews, mints, or a few days of brushing. What might you notice? A persistent, deep foul smell that keeps returning. Your dog chewing more on one side, dropping kibble, or suddenly preferring softer food. A little blood on a toy, in the water bowl, or on the lip. Pawing at the face, a new sensitivity when you touch the muzzle, or a subtle facial asymmetry that wasn't there before. Sometimes you can see a lump, but many times you can't, at least not safely at home. Your next step here isn't to pry the mouth open and go hunting. If your dog is resisting, you can get bitten, and you can also make a painful area worse. Instead, book a veterinary oral exam. If you do see any mass, ulcer, or unexplained bleeding, don't wait. Get it checked promptly. Early identification matters, and eating normally doesn't rule it out. Now that we've covered all 5 causes, let's talk about what you can do now. Okay, here's what to do right now without guessing and without spiraling. Step 1. Describe the smell. Rotten egg sulfur, sweet/acetone, ammonia-like, fecal/fermented. Just bad isn't helpful. A specific description is. Step 2. Scan for other changes over the past couple weeks. Drinking more, peeing more or less, weight loss, vomiting, lower energy, picky eating, chewing on one side. Jot it in your phone. Timing matters. If you can, take a photo of the gumline and a short video of any regurgitation or odd chewing. Those details help your vet triage over the phone and may save you a second visit later. Step 3. Do a gentle mouth check. Use good light. Lift the lip and look at the gumline for redness or swelling, and look for obvious tartar, sores, bleeding, or any lump. If your dog pulls away, don't force it. Step 4. Think about what changed recently. New food, new treats, access to cat litter, compost, or garbage, new meds, or a change in routine can create temporary odors. Remove the obvious source if you can. Step 5. Make the call. If the odor is persistent longer than a week, if it's sweet/acetone or ammonia-like, if there are any other symptoms, or if you see bleeding or a mass, contact your veterinarian. Next, I'll give you the red flags that mean call today, not schedule when you can. Let's draw a clear safety line, because rotten breath is annoying, but certain combinations change the timeline. Call your veterinarian the same day if you notice sweet or acetone-like breath plus vomiting, unusual sleepiness, or a sudden drop in appetite. That pattern can sometimes fit diabetic ketoacidosis, and waiting overnight isn't worth the risk. call promptly too if the breath is ammonia-like and your dog is vomiting, refusing food, acting very weak, or seems dehydrated. Kidney-related toxin buildup can make dogs feel sick fast. If you see any lump in the mouth, a sore that won't stop bleeding, or blood on toys or in the water bowl, book an exam as soon as possible. Don't assume it's just a cut. Seek urgent advice if your dog collapses, becomes disoriented, or suddenly seems painfully different. And be extra cautious with puppies, frail seniors, or dogs with chronic illness. A new persistent breath change deserves a call, even if they're still wagging. If your dog won't eat or drink for more than 24 hours or is repeatedly regurgitating, call for urgent guidance today. If your dog simply has persistent sulfuric breath, mild gum redness, or recurring fecal odor without other symptoms, a scheduled appointment within a week or two is reasonable. Now let's tie it all together. You noticed a change, and that matters more than you think. Quick recap: rotten egg sulfur breath often points to gumline bacteria and periodontal disease. Sweet or acetone breath can be a diabetes warning. Sharp ammonia breath can be tied to kidney trouble. Fecal or fermented breath may come from poop snacks, garbage, or a GI issue like regurgitation, and a deep decaying odor that won't improve can sometimes signal an oral growth that needs an exam. If you missed it at first, you didn't fail. Dogs don't hand us clear symptoms, early owners have to spot patterns, and you're doing that right now. Use the smell as information, pair it with other changes, and don't hesitate to call your vet when the red flags show up. Question for you: what did the smell remind you of, and what ended up being the cause? Share below. Subscribe for more dog health checklists like this.